education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Good morning, everybody. Good morning, good morning, good morning. My name's Evelyn Mentzer. All my friends called me Evie. I'm a doctor, I'm a consultant ophthalmologist, and it gives me great pleasure to welcome you to the Carn Health Hour. So the topic that we're going to discuss today will be delivered to us by a fantastic GP called Dr. Nneka Anaegbu. Now, Dr. Nneka Anaegbu was a former consultant in Nigeria, and the topic of discussion today is called Be a Lifesaver, an urgent call for organ donation to save Black lives. Now, I don't know whether any people who are participating in the session today are organ donors, but I'm an organ donor. Dr. Nneka will describe a situation where she decided to be an organ donor. I'll let her do that. But I also want to just say that this session is being live streamed on Facebook, on LinkedIn. And please, I would encourage you to put your questions in the chat box. So let me pass on to Dr. Nneka Anaegbu.
Hello, good morning, everyone, and wherever you are, the time of the day, greetings to you. Thank you for taking time out on your tight schedule to attend this program. So before we started, Evie was asking, why did I want to talk about organ donation? Someone asked that earlier. We don't do things like that as a Black Caribbean community and ethnic minorities. Yes, so the reason why I became interested, I'll say right from when I was young as a medical student, while we were doing the anatomy, organs is what we discussed, I had interest in organs. And then when I was an anesthetist, I remember a scenario where a young man suddenly died and was in the ITU, intensive care, and he was passing away and eventually died, and asked the wife, are you happy for his organs to be donated to keep people alive? And she didn't agree to it. And I wondered how many lives would have been saved, even though the man is no longer there, but he would have continued doing good by donating organs. And there are lots of reasons why she may have said no, which is one of the reasons why we're having this discussion about organ donation. So I don't blame her. It could be she's not aware, and that is one of the reasons why I decided to talk about this.
Thank you, Dr. Anaegbu. So yeah, so I mean, you describe a really good situation of a Black person dying and the impact of the organs on that Black person could be for 7 to 8 other Black people, which would change their lives. And so I recognize that. So somebody like myself who is an eye surgeon, I know that having a corneal graft, which is the clear window at the front of your eye, having that donated because they're quite rare, that would give sight to another person. And for the other organs, it would give life in different, facets for other people. So I think we're really quite keen to hear your talk. So let's take it away and hear what you have to say.
Okay. So I've already introduced myself, and we're talking about organ donation in Black and ethnic minority, sorry, in Black and Caribbean population. My name is Dr. Anaegbu again. So we're going to talk about what is organ donation, importance of organ donation, barriers to organ donation, overcoming the barriers, a success story, and then we summarize.
Sorry, Doctor, before you carry on, could you please share your screen so we can see your slides? Oh, yeah, thanks.
So if you just the green box at the bottom, Dr. Nneka, where it says share screen, if you click on that button at the bottom and then choose the screen on the left, the top left, and then click share, which I think should be bottom right. So there's a green button that says share screen at the bottom of the screen.
Share.
Yeah.
Can you see it now?
It's perfect. Thank you so much.
Oh, thank you. Okay. So I'll go back to the agenda so that you can see it. To start with what is organ donation, importance of organ donation, barriers to organ donation, how do we overcome the barriers, a success story, and then we summarize. Now, what is organ donation? Donating organ or tissue to save or improve life. So organs are like solid organs. Forgive me for saying the obvious. This is the organs like the lungs, the heart, the liver and the pancreas. These are like solid organs that we can only donate when we're no longer alive. But there are some tissues that we can donate while we're alive, such as blood donation or kidney donation. And most people do that for their relatives. And some people could even do it for others. Now, what's the statistics among our people? About 40% of Black Caribbean support organ donation, according to statistics done on the NHS by the Organ Donation Group. But just less than 15% are willing to donate their organs after death. And 13% have ever talked about organ donation. And less than 4%, which is negligible, have registered. I can attest that I have registered, and Evie has informed us earlier that she has already registered for organ donation. Now, again, these are the organs that can be donated, like the heart, the lung, the liver, pancreas, small intestines, kidneys, when we're no longer alive. And some people wonder and say, oh, if I donate my organs, what will be left to be buried? So you can see these are all things hidden inside the body. Even the eye can be donated, and most times eyes are closed. So giving your organ is like giving gifts. You see people handing in gifts, the liver there, the heart, the eye, the lung, which is precious. Now, what's the importance of organ donation? As of March last year, just 2,237 people of ethnic minority were on organ donation list, and it has increased by about 300 from the previous year. So up to 8 lives can be saved by one person after death. That is multiplying ourselves into 8 places after death, keep on living. So according to statistics, the Black and Caribbean wait longer for organ donation And it's obvious because we are not on the register list, we're not donating. And it's been found that a match is accepted better when it's from similar ethnicity. So even if people are on the list and there's an organ, giving it to them, there may be organ rejection if they don't match. So that's why a lot of us who need or who may need organ, we never know. We're doing this because we want to keep people alive, and we never know, it could be us that could be needing this, and we want so that to reduce this waiting time for ourselves and our people. So if you don't mind, there's this survey that we could do for ourselves, those of us here. Have you had any formal education or training on organ donation? This may take just a few minutes. If you log on to menti.com, and there's a code there on the top, it's 4107523, and you could answer yes, no, or unsure. Evie, shall I leave it with you to organize this?
So if you just go into your browser on your phone, so just get your phone and just type menti.com, and then when it asks you, it'll ask you to enter an access code. So the access code is 4107523, and then you click join once you've done that. And then what you're seeing displayed here, you will then see displayed on your phone, or if you're using your desktop or your laptop, open up another browser. Again, type menti.com, go in, type the code 4107523. So the question is, have you had any formal education-teaching on organ donation? So then you select whichever the option is, and then you select, and then you put submit. So everybody should start voting. And I think that, I don't know whether you can see on your slide, Dr. Nneka, how many people have actually voted, but I've voted.
Okay.
I think when you change the slides, I don't know whether it then...
Okay, when I change the slides.
Yes, then it'll show the result.
Okay. And that will be clicking on the next one, is
I
it?
think so, yeah.
Okay.
And if not, you can just go back.
Okay. I'll wait for people to... Let me do it. I'm just giving time for people who are trying to do it for the first time to fiddle around.
And if you can't access menti.com, you can put your response in the chat box.
Yes, that's a good idea. Okay, so 11 people have responded, and
That's
let me go
about
to
just slightly less than 50%, so that's not bad because there's 24 people in the room.
Okay. So let me see if it shows.
Yeah, that's good.
So that's the result. Well done all for voting. So 3 people have, 5 people have not, and the rest are not sure. Thank you for your responses. And the next question is, will you consider signing in for organ donation?
It didn't move on the Menti, so you might have to just log in again. So go into menti.com, put in the code 4107523, and then again click join, and then answer the question is, will you consider signing up for organ donation? Oh no, the next one's not coming up on my phone.
It's not coming up.
The
Okay.
second one, no, I don't know why. Showing the first one still. So anyway, I think everybody should just put their answers in the chat because it's not actually moving on
Yes,
on
it's
Menti.
not, unfortunately, sorry.
That's okay. Yeah, so the sorts of comments that people are putting in the chat is maybe, no, maybe don't know, would love to, yes, after receiving more information on what is organ donations. I suppose that's the purpose of this morning, is to find out a little bit more about, what is actually involved.
Yes, okay. So thank you for your response. Now we move on to barriers to organ donation, lack of awareness, just like the response we just got now, that people may not be aware of what it's all about, how to go about it, is it right, is it wrong? Mistrust in the healthcare. There have been some myths about where people think when they get to the hospital, if they have signed up for organ donation, they would not be given the adequate treatment so that their organs can be harvested, which is not true at all. People are treated all equally on given the best healthcare opportunity. Organ donation is usually after death, and nobody's actually interested in harvesting people's organs that way. Fear of mutilation, like we talked earlier, people will say, if I donate all my organs, what would be left to be buried if I was going to be buried? Most of the organs are hidden away, that are harvested. Nobody sees. The people are not being mutilated. It's mainly inside the body, even if it's the eyes are shut, and people are presented like nothing ever happened to them. Faith and religion. Some people believe that, it's against my religion, it's against my faith, but they are not aware that religions, societies, and bodies are happy and are supporting and accepting organ donation. Culture is a big thing, especially with us. The Black Caribbean people, we have a lot of culture that we strongly hold on to and hardly want to change. But if we know that this is something that will benefit us, our children, for example, all of us here, I believe, I couldn't say all of us, most of us here, if donating one kidney to our child for that child to live was on the table, a lot of us, even though it's maybe a difficult situation, we may consider donating our kidneys so that our child can keep on living. So what are the how do we overcome these barriers? Mainly by improving awareness, which is what we are doing this morning. Before I go on to overcoming barriers, if you don't mind me going back to barriers, can we open the floor that anybody wants to say anything about barriers or say against it or support it? Anybody wanted to say anything?
So just this is a question out to the audience. It'd be really good if maybe if you either want to put something in the chat or whether, I don't know whether people are allowed to say out loud, but what are the barriers that you feel that there are that would prevent you or anybody that you know, or maybe you're just yourself, that would prevent you or stop you from registering as an organ donor? What would those barriers be? So I would like to start, Dr. Nneka, which I think for our community might be an actual significant barrier for donating organs, and that is because of medical racism, for fear that because of all the previous nasty things that have happened to Black African, Black Caribbean people in the past when it's had something to do with medicine. So there's that lack of trust. So I think it's a combination of lack of trust as a consequence of medical systemic racism. But it'll be interesting to hear from others in the audience.
Yes, so that's correct. Lack of trust. And the good thing is in the NHS, there are lots of us working in the healthcare, and that is the way of improving our presence and also participating. But apart from us being there, there is something called in the medical ethics that every doctor should follow, no matter where you're from. Do no harm. So that policy guides the medical team not to do that. We know in the past, a lot of things have happened, but now there are changes, and we don't see it happening these days.
I think another barrier that might be in our community, Dr. Nneka, may be faith and religion. So
Yes.
that could be. So for certain people from certain religious groups, so they may not want to be an organ donor or even donate blood.
Yes, that is true, especially with the Jehovah's Witness. But there have been some changes, even in the Jehovah's Witness, where they can accept some type of blood, maybe the plasma and not the red cells, and different ways of them signing into this donation. Someone has said, what if people have chronic long-term illness like diabetes, sickle cell, so the organs that are, for example, someone who has diabetes will benefit from a pancreas transplant. So it's beneficial to diabetes people.
Yes.
Someone who has chronic lung disease can benefit from a lung transplant. And they are not able to donate though, because they go for healthy tissues that can continue to be beneficial to the recipient. So faith and religion, yes, like you said, someone has mentioned that as well. Okay. Now, if we go on to how do we overcome barriers? We've talked about improving awareness, which we're doing now, engaging family members. So I have mentioned that I'm on the organ donor list. I think it to my family every time they know that. So if anything happens, they are not going to feel guilty if they agree. So in the NHS, automatically everybody is signed to be an organ donor, whether you know, like it. No, initially you're all signed in automatically, but you can opt out if you don't want. Those people who are signing are not sure, maybe, I don't know, they're still on this list. If anything happens to any of us, the family are the ones that makes the final decision, even if we are all on the organ donor list. So it doesn't mean because we are on the list, we're all going to be donors. So if our family members are aware of our decision, then they would eventually be asked and they know what your decision is, and it makes it easier. So engaging family members with our decision. Then culture, tailored messaging and campaigns. So it's easy for the Caucasians to talk about organ donor because they see it as, oh yes, why not? But for us, for some of the reasons we mentioned before, it may be challenging. Even until I did a bit of research for this course, for this presentation, I wasn't aware of that even culturally it's accepted, religiously is accepted. In our churches, it is accepted in the Bible and the Quran from what I have researched, even Buddhism. So it's helping humanity, which is being love for humanity is the center of all religion and culture, I believe. Then collaborating with religious leaders and communities. So if in our communities we talk more about this organ donation, yes, I know when we talk about it, we feel like, oh, do people want my organ? Oh, who knows? We could be needing people's organ. We are trying to sustain and improve ourselves because, like I said earlier, the Blacks and the ethnic minorities wait longer to accept and to get matches. Why? Because we are not on the list. Interestingly, yesterday I was with a patient and he was telling me about how his nephew just received a liver. And I was excited because today I'm going to talk about organ donation and somebody was just telling me, oh, someone received liver. So it means that it's something that is needed, is real, and we should all hopefully key into it. Now, regarding overcoming barriers, do we have any thoughts of how else we could overcome these barriers, please?
Can I just interject very slightly, Dr. Nneka? So there are a few people who have specifically said if they've got chronic long-term conditions themselves.
Yes.
So in the chat, so we have somebody who said that they have lupus, somebody who says that if they are diabetic or if they have
Yes.
sickle cell themselves, could
Yes.
they themselves, could they sign up to be an organ donor?
Yes, because if the lung is maybe chronic lung disease, there are other parts of the body of this person that is functioning perfectly well that will be useful for other lives.
Right, thank you.
When we are no longer here. So
Thank
it's organs, other organs are useful, yeah.
Thank you.
Any other ways that we can overcome this barrier? Because it's our thing, trying to help ourselves. You can type in the chat or unmute yourself.
So somebody in the chat has suggested, would it be wise to discuss with your GP before making the decision? That could be a way of overcoming the barriers, perhaps.
Correct. So earlier I was having a chat with you, Evie, and I said, you said, oh, I understand you're talking about this as a point of view of an anesthetist. What about as a GP? And I mentioned there was a lady who died and was in ITU many miles away. And the ITU doctors called the surgery and said, this patient is she on the organ donation? Has she mentioned anything about donating her organs? So if she had had this chat with her GP, it will be somewhere in the notes, which will be relevant, even if the family are not aware. It's documented that this person has showed interest or consented. Is there any other question in this chat? Because it looks like I don't see the chats now.
So there's somebody who's actually asked a question.
Yeah.
That let me just find it. Apologies. Well, there's somebody who'd already talked about religion and mistrust as being, barriers, which is a common theme. But somebody had a question as to whenever someone donates their organs, does it always go into the body, or sometimes do the organs end up being used for research? So I think that's a really good question. So somebody might be thinking about wanting to go on the organ donation register, but what they really would like to understand is whether whatever it is that they're donating, it definitely goes into the body, like the gifts that you talked about at the start of your talk, or could they end up being used for research?
Okay, so organ donation that we are aware of in the NHS is for saving lives. there is a different part where scientists by themselves, I've met a patient who said, oh, I've donated my body already for science research. That is a different thing. Some people can certainly sign up for that, but for the organ donation we're talking about is mainly to save lives, not for research.
Thank you for that clarification.
Okay. So going on to increasing donor registration. So we're promoting, so by promoting donor registration drives, once again, this is what we're all doing here today, providing resources for donor registration. So for people who have different languages, so, providing resources for them and giving channels where they can get more information to register. Encouraging family discussion about organ donation. My hope is that after this talk today, all of us will have a chat about it. It doesn't mean that you have to go and register. It is a personal choice. But at least have a chat about it. Just have discussions, because from discussions, a lot of things come up. You may get more ideas when you talk to people, and that may change or not change what you think. And underneath here is the website where you can make a decision. On that website, you can see whether you're on the organ donation list, which automatically all of us are signed into. You can opt out if you're not interested at the moment, and if you change your mind later, you can still opt in. Now, this is one of the ways of removing the barriers. So this reverend is talking here in this video about how she donates blood.
So I don't know whether the volume can be increased because we can't quite.
Okay, sure. I would lead to that. Any better?
Still quite quiet.
Okay. I think it's showing the wordings on the screen.
I think that's fine.
Today, www.blood.org.
So this side is talking about a patient who has lupus and has received a kidney.
Dr. Nneka, could I just chip in? Sorry, there's a way that you can make the sound a bit louder. If you go to view options, there should be an option to share computer sound at the top of your Zoom, and then hopefully we'll be able to hear the brilliant words that they're all saying right now.
Right.
It should be at the top of your Zoom options.
Okay.
Sam, could you chip in if I've got anything wrong there, please?
Let's see.
Yeah, just give me 1 second. Um, Hi, Doctor. Please, if you could go, I think you're using a second screen as well. I think where you can see the Zoom pictures. If you hover on that bar that shows your Zoom,
If I can what?
if you hover against the bar that shows your Zoom streaming, um,
What?
yeah, streaming bar, there should be a
Yes,
turn on
yes.
sound. Can you see the turn on sound button, please? What we could do,
Mute
just
my audio.
yeah, the audio thing, yeah.
Mm,
Let's try that.
No, it says mute my audio, stop video, virtual. Where could I find it?
I think it's all right for you just to play the video and everybody can just read the text along the bottom.
Okay.
It is the thing itself that I survived 10 years of it, and I'm just counting. I have carried 22, which progressed quickly, septicemia and multiple myeloma, which I was a trial therapist. Look, what can the challenge for myself. I want to go to miracle. I'm here. I'm alive. There's one chance of life. My children are going to see me. I can find the have tubes coming out of my nose everywhere. Just wanted to walk into something. Life after where I'm right now, where I was to. More again, my brothers, my sisters, my brothers, my friends, being able to do that again. The bravery, the joy. It's not no matter how we do it, no matter what angle we do it, it's
Okay. Does anybody have anything to say about that video?
So I know that we had some challenges with hearing the sound properly, and we were able to, some people were able to read the subtitles, but I think it would be helpful to maybe get the links for the two videos, and maybe they can be shared, maybe on the, I don't know, Khan website or something that people can look at later.
Okay.
But I
Yeah.
felt that that it was the second video was it was quite an emotional one
Yeah.
for the recipient of the of the organ donation, about how helpful it was for her. But I don't think anybody could hear the audio very clearly.
Sorry about that. Okay, I'll find the link and I'll send it.
They've shared it. It's okay. They've shared it in the chat.
Thank
That's
you.
good.
All right. So going back to removing the barriers, like I've mentioned earlier, different religion have supported organ donation. So we have different, I believe we could have possibly have different religion in our midst today. So the Buddhists support organ donation, and they say, what loss do I suffer to give an unwanted organ after my death to give another person life? And they've mentioned about how the Buddhist also donated his own body. And the Methodist Church has consistently supported organ donation and transplantation in many circumstances, which is a means of healing, which God gives to all of us. And even the Sharia law has mentioned that if anyone saves lives as it donates his organ, in summary, his person saves lives, and it is a blessed act. There's another Mentimeter, but before we go on to that, could anybody share anything, experiences, their thoughts? You can type it in the chat or unmute. Okay. If not, then we will go on to another Mentimeter if you don't mind. Can I ask us to log in again to, will you consider signing for an organ donation? I'm not hoping that everybody will suddenly change their mind, but hoping that this is a food for thought for all of us to think about. And the code for the Mentimeter is 41. Can you see the code?
Yeah, so I'll just, before that, let's just for people who probably didn't join at the time we said the website. So if everybody on your phone, or on, if you've got your laptop or your desktop, open up another browser, but on your phone, in your search in your browser, if you type menti.com, that's MENTI.com, and then what will happen is that you will then be asked to enter a code. So the code that if you answer when you get to the menti.com website is 41788802. So that's 41788802. So then you click join, and then you the question is being asked about what your gender is. So if you then select your gender and then click submit.
I think with the age, we can skip that and go to the next question, because it's not, let's see, it doesn't look like it's accepting one number. So we can skip that one and go to the next question.
Okay, I think it's making you having to submit something before I think it moves on.
Yeah, so probably if you just click next without submitting, there's another question at the end.
Okay, so if in the box for the age, just type next and then submit, and then that will take you to the next question. So that's when the next question says, will you consider signing up for organ donation? And then if you just select your option and then submit. So I think you're just waiting a few minutes for some responses.
Yes. Okay, it looks like it's getting. Okay.
So it looks like 8 people have responded, whether or not they would consider signing up for organ donation. So 7 out of the 8 people that have responded, 7 people have said yes, and 1 person has said no.
Yeah. Thank you so much for joining in today. And it looks like our meeting is not in vain. Hopefully, we would, no matter how long we leave, we would continue to save lives by signing in, and we hopefully will take the action, talk about it, continue to spread the news. And thank you so much. Open to questions now.
So thank you so much, Dr. Nneka. Thank you so much for your excellent talk. There is a question that somebody has actually put into the chat. And we've got some comments here. Lovely presentation, Dr. Nneka. Thank you. Someone else has said, I'm already signed up since 2016 and have had a discussion with my family. And I think that's always a very good thing to do. Someone else has said, I need a GP and family discussion on this topic. But at least people are having the conversation, I think, which is really important. And someone else says, I'm definitely going to raise a discussion in my church so that this topic can be talked about with understanding. And I think that's a really, insightful, thoughtful, comment to have made. And I think that there was a question here from someone who said, a few years ago, I had an unprovoked pulmonary embolism. Before I go on any further with the question, do you want to explain, Dr. Nneka, what pulmonary embolism is? Some people might not know what that is.
Oh, sorry. I was going to share that later. Okay, so pulmonary embolism is a condition where there's blood clots that travels from mainly the lower limbs down to the great big blood vessels and goes into the lungs. The lung is called pulmo. It's another word for air. It blocks the lungs, and the heart and the lungs are connected, and a lot of people could die from it if not attended to urgently by using blood thinners. So just general knowledge, those of us who travel long distance, sometimes you hear that someone was on a long flight and died in the aircraft. Sitting for a long time could encourage blood clots. That's why in the plane they were encouraged to move your legs, walk around, and other disease conditions can also cause blood clots. I hope I haven't talked too much
absolutely.
about.
Thank you, Dr. Nneka. So the question was that this gentleman had a pulmonary embolism, and they're now required to take a blood thinner, as you just described, called rivaroxaban, on a daily basis. So and can no longer donate blood. So they're asking, are there any other medications that negate an individual's ability to donate blood?
Yes, so there are few that are on the list, and that will be considered when organs are being donated. There's a long list, but it's not just people on like high blood pressure medication doesn't stop them from donating blood. It may be more complicated medications like chemotherapy for cancer and long-term biologics, but common medications should be fine, I would say, because even to preserve those organs, medications are being used to even keep the people during the transplant. So it's generally fine.
So somebody has made a comment in the chat that they are a beneficiary of organ donation.
Wow.
So they've received a gift of an organ donation, which is really wonderful. And someone else
Awesome.
has said another lovely presentation, Dr. Nneka. So we've got another question. This is from Molly on YouTube, who says, I wonder if there is an encouragement of family donations as a first step.
So generally, if people who are still living, it would, sorry, I can't see you, just trying to move around my slides. For people who are living donors, they mostly go to their family first because the match is closer with family.
Right.
And that is encouraged.
Okay. So we've also got another question from somebody on YouTube. Anne says, including it, willingness to be an organ donor in a will is also crucial after informing family members.
Excellent. So that's a new thing for me to learn, and that's why we're all here learning from each other. That's good.
Okay, and somebody in the chat says, thank you, Dr. Nneka. I'll encourage everyone to consider donation, even blood donation. So that's as a consequence of your talk, Dr. Nneka. And I think, hearing from people that look like us, when people hear from doctors that look like us, then they feel more confident and they feel much safer and they feel able to ask questions easily and can make those considerations.
Yes.
Now, I don't know whether there are any other questions that anybody wants to put in the chat. Now, you asked the question about what could be done to encourage people to give donations. And someone did make a comment about incentives. So are there any incentives that are given for people who may want to consider donating their organs?
I'm not sure about incentives at the moment. Maybe something I could research on, but I think it's just a gift. And like we said earlier, most people donate when they're not alive. So, but what government, I think what they do is they give to families who have donated some kind of recognition awards or things like that. But then maybe more that I don't know.
Yeah. And this is a question from Ambrose on YouTube. And they said, what is the implication for the donor who may give away just one of their kidneys? So we all have two kidneys. So what Ambrose is asking on YouTube is that what is the implication for the donor themselves if they actually give away one of their kidneys?
So people who have given, of course, have given out of love, and they would have been checked to make sure that they are okay to survive on one of the kidneys. And they will be guided on things to look out for, how to live healthy, and they are prioritized because if I see someone who has one kidney, I do more because as a doctor, I know that person is needing that kidney. So I've seen lots of patients with kidney. Once I see one kidney, I do more because I know they need it, really, really need it. So it's one of the advantages that you will be checked to make sure that you're fine and you will continue to be followed up.
Wonderful. And we've just got so many more compliments about your presentation, Dr. Nneka. So we've got Hazel from Manchester who says, thank you, Dr. Nneka, for this presentation. Very insightful. Continue with this excellent work. And we've got Elsie who said, very informative and useful session. Thank you very much. So a lot of positive comments. Somebody has asked an interesting question. Can you live without your pancreas if it's donated. I already know that's
So we wouldn't actually be asking people to donate their pancreas because they need it
when they're alive. When they're
when
alive.
they're alive. So most of these organs are donated when we're not alive. The essential ones, like the heart, you're not going to donate your heart or your lungs, or it's when we're not here. But there's some that you can donate while you're here, like the kidneys, blood.
Yes, so we need the pancreas because it produces insulin, keeps our blood sugar at the right level. And if we don't have our pancreas, then we'll all be going around with the impact of diabetes. So I don't know whether there are any other questions actually. Everybody's saying thank you. Wonderful, informative session. So I think that what I would like to just say is just thank you so much, Dr. Nneka Anaegbu, for your insightful presentation today. Thank you for your time. Khan is always grateful for doctors, other clinicians, healthcare practitioners that donate their Saturday morning for this health hour. There is just one thing that somebody has just put in the chat, just as I was just about to close, saying, agreed, medical trials have incentives, energy, time, travel, data, yeah. So people, that's the big difference. You know, when people who participate in clinical trials, and that's another conversation for another day, isn't it? Usually they are given financial travel incentives for participating in clinical trials because there is underrepresentation of Black people in clinical trials, and we can understand the reasons for it. But that. Don't even get me started on that topic. That's a topic for another day. But somebody has also asked, is it possible to donate ovaries?
Oh yes, not we donate mainly the eggs, so you
Eggs.
can donate eggs.
Donate the eggs. That's a beautiful gift, isn't it? It's a gift of a child. Wow. Donating your eggs for the gift of a child. Yes. And somebody, and then Millicent has said, I will consider registering. They said because of your beautiful presentation. Isn't that amazing? Isn't that great that that's been achieved? So once again, Dr. Nneka, thank you for
On
your.
a lighter note, I know we've talked about giving our organs when we're not here. Let us remember to leave. I have a picture of my visit to Bali. So let's leave while we're alive, enjoy life, because we won't be needing all these organs when we're no longer here. Thank you.
Thank you. And that's a really very good point to end on. But before we go, I would like to let everybody know about, and I hope they're going to share the poster or the banner about it, about the event in July. Are they going to show it? So what it is that, so in Cannes, we're going to have something called the Black Healthcare Awards. All right. I'm a great believer in Black joy, all right, promoting ourselves, celebrating ourselves. So if you have you been cared by a particularly attentive Black nurse? Does your Black doctor go far beyond the call of duty? Can you please bring this to our attention and nominate for the Cannes Black Healthcare Awards? I think what I'll do is, let me see if I can actually just share the picture myself. Let me just do a share, sorry. I'm just like, God, honestly, where's it gone? Picture, oh, here it is. Here we go. Sorry, you saw my desktop. All right, is that displaying? Hello?
Yes.
Yes, okay.
Yes.
So this is the Caribbean African and Health Network are hosting the Black Healthcare Awards. This is for professionals in practice, so Black nurses, Black doctors, and the award ceremony is happening on Saturday, the 27th of July 2024 from 6 till late. Can you imagine? This is going to be in London at the Park Plaza. That's the price of the tickets. But what we would really, really like you to do for this wonderful black tie event where you're going to have drinks on arrival, you'll have a three-course meal, there's an award ceremony, there'll be live entertainment, and you'll be able to meet the patrons, is to nominate. If you could please, please, please nominate, that would be absolutely wonderful. So it's bank holiday weekend. What I'd like to just wish everybody, I'd like to thank Dr. Nneka once again for giving such a wonderful presentation, and to the rest of everybody who's tuned in to the Zoom on YouTube, LinkedIn, Facebook, wherever you are. Have an absolutely wonderful and fantastic bank holiday weekend. Bye for now.
Thank you so much, Dr. Evelyn. And we're going to have Benedict share some closing slides just so that people are aware of what's happening over the course of the next few weeks. Thank you so much again, Dr. Evie and Dr. Nneka. Just a few minutes now to hear from Benedict. Thank you.
Thank you, Dr. Nneka and Dr. Evie. That was a very informative session. And you can join us at our next one, 11th of May. That will be the diabetes digit session. We will leave the link in the bio, and we'll also leave it on our website as well that you can join. We all know diabetes is a common issue, but
sorry, Benedict, we can't see your slides just yet, or at least I can't. Would you be able to share them, please? Thank you.
Okay. Can everyone see now?
Yes, we can. Thank you. Could you blow that up to
Great.
full screen, please? Thank you.
Yeah, no, of course. Yeah, so we have our Diabetes Digits Health Hour on the 11th of May. We'll leave the link in the bio in the description, and we'll also leave it on our website. It's important to know the numbers surrounding diabetes as well as the issue itself. So that'll be with Dr. Joan St. John. And next, we have a discussion on Tuesday, the 7th of May, which is called Sitting is Next Smoking, where we can discuss how being at your office and your desk for so long can have a negative impact on your health. That will be with Sylvia, guest speakers, Dr. Emmanuel and Orlando, who's a physical instructor. That will be Tuesday, 7th of May as well. So we'll leave the link in the website as well, and also register to our email to get the first-hand alerts. We are continuing to run our diabetes peer-to-peer support. That'll be in the first Monday of every month, 5 p.m. to 7 p.m. and the fourth Wednesday of every month, 5 p.m. to 7 p.m. And that will be in Newton, and the other one will be in Moston. So yeah, if you want to book a place, Abundance's number is there and the email. We also have focus groups. So for join our focus groups with diabetes 1 and 2, that'll be in the 4th and 5th of May, and earn £25 for focus groups. So register there and feel free to join. And then if you are a new mom of Caribbean African descent, please take part in this survey. Each participant will receive a £10 voucher from so make sure you're pregnant and you are Caribbean African descent, feel free to join and sign up. And then we have a family advocacy support session on Thursday, the 9th of May. The speaker will be involved in Manchester City Council. So this will be discussing about issues that families may face in health, and be focusing on how we power our health as African and Caribbean communities. And that'll be on the 9th of May. So feel free to register again, and the number is there. And on the 24th of May, we have a huge event, Africa Day, for 5 hours. It will be in the University of Bolton. There will be networking, panel discussions, success stories, cultural performances, business stores, and keynote speeches. So if you're interested to book a stall or to register, the links are here. And for more information, feel free to contact Africa Day at Conduct. The number is just next. Yeah. So feel free to register again. Yeah, thank you for joining us today. We hope to see you all next week.
Thanks.